Good morning, good afternoon, and good evening to everybody. Welcome to the fourth session of the Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. My name is Peter Barry. I work at the Climate Change and Health Office at Health Canada, and I'll be your moderator for today's session. So as a note, there's simultaneous translation. It's available in English, French, and Portuguese by using the button at the bottom of your screen, the globe icon. So last session, session 3, was on approaches to scaling up health adaptation that really focused on how do we understand risk to health from climate change, risk to health systems, and how do we do this through conducting climate change and health systems, climate change and health assessments, a really important activity. Well, we're going to build on this in this fourth session of approaches to scaling up health adaptation to look at another pillar in terms of understanding whether health systems are making progress towards climate resiliency. So this will be a really important discussion. Now, we're really lucky to have leading experts today share their experiences with us and their knowledge on this particular topic. And so just as a reminder, in terms of the course objectives, they're really to understand the importance of rapidly scaling up climate change and health adaptation actions, to prepare individuals, communities, and health systems, but also to describe key actions for scaling up health adaptation within jurisdictions, and also identify opportunities for increasing health adaptation efforts that support health, but also health equity, which is really important, and to be prepared to work with a broad range of partners to address barriers that you might face to scale up health adaptation. And in terms of this particular session, we're going to identify key factors that determine whether a jurisdiction can scale up. So for example, in terms of maybe a pilot or a project to successfully build resilience, recognize examples of commonly of community empowerment approaches that can support scaling up these efforts and really moving further faster, but also understand the purpose and benefits of monitoring and evaluation activities to support scaling up efforts, and identify some indicators that people can use to actually undertake this work. And really to describe the concept of adaptive management and why feedback mechanisms are really important for measuring our progress moving forward. So just in terms of some of the logistics, these are 90-minute sessions. The session will end with a question and answer section. And please enter your questions for the presenters in the Q&A box. Session recordings, video recordings, and slide decks and the resources will be made available on the course website. And in terms of attendance, attendance is automatically recorded during the live Zoom sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link. And YouTube views will not count towards attendance. In terms of the certificate of participation, participants who attend 8 or more of the live Zoom sessions and pass the final exam with a score of greater than 70% at the end of the course will be awarded a certificate of participation in climate and health. And please note, the certificate of participation is only available.
Going through it, period.
Is only available to people who use the same email for registration, all Zoom sessions, and the exam. And just a reminder, this is an interactive course, so we have a couple of sessions, which is really exciting, where participants can provide information to help shape the discussions. And so it's a reminder for session 9 to please submit case studies that might be of interest to all participants that you could present on. And these will really focus on applications and gaps in current tools and guidance. And also, we have a WhatsApp group that you can connect with us on. And so please do take advantage of that opportunity for really important reminders and information on the course. So with that, it's a really great pleasure to introduce our speakers for today. We have 4 of them. Dr. Carlos Corvalan is an environmental health specialist with training in occupational and environmental epidemiology. He joined the World Health Organization in 1993, where he worked first as a scientist, then as a coordinator of the unit dealing with environmental and occupational health. Between 2008 and 2015, he was a senior advisor on risk assessment and global environmental change at the Pan American Health Organization. And currently, he's an adjunct professor at the Sydney School of Public Health, University of Sydney, and a UNFCCC nominated expert for the Global Goal on Adaptation. And Carlos will be followed by Dr. Noemi Tirado Bastillos. And Noemi is the head of genotoxicology unit at the Genetics Institute at the Universidad Mayor de San Andres in Bolivia. And Noemi will be followed by Jenny McAdams. Jenny McAdams holds a Master of Public Health from Wright State University and is a registered environmental health specialist. She is supervisor of the Sustainability and Recreational Health section at Franklin County Public Health in the state of Ohio in the United States. She's served on the National Environmental Health Association of Climate Change Committee. And I think that presentation will also include Layla Abraham, who's an environmental health and safety technician and a certified health education specialist. She's currently the sanitarian in training for the Sustainability and Recreational Health section at Franklin County Public Health, where she focuses on outreach and education, especially in air quality efforts. So with that, I'll turn it over to Carlos.
Thanks very much, Peter. So let me see if you can see my desktop there. I'm in desktop number 2. Can you confirm that you see the screen now that I'm sharing?
Not yet, Carlos. There we go.
Okay. So yes, I'm Carlos, and I'm going to be presenting as Peter mentioned. And specifically, what I'm going to be doing is looking at 2 of the learning objectives. One has to do with the purpose and benefit of monitoring and evaluation activities, supporting to scaling up efforts in the context of climate change and health. And the second part will be adaptive management approach. So these are your 2 learning objectives. I'm going to start with the second one because the second one really should come for better understanding before the monitoring and evaluation. So what is adaptive management? And then you look at the internet and you look at definitions and you find many things. It doesn't come obviously from the health area, but has been adapted for health and climate. And of all the definitions I found, I think the one by Chris Eby seems to be the most logical for the work that we're doing here, which is the definition is that it is a structure and iterative process of decision making in the face of imperfect information with the aim of reducing uncertainty and through monitoring and evaluation. So it's got the 3 elements that we are going to be discussing today. So why is it that in climate change and health we need adaptive management? So the main reason is that first, because of uncertainty. So what is happening is that we have climate models that are projections that they have a known around the future warming, about regional impacts, local impacts, policy effectiveness. So we have an uncertainty there. We know that the systems is called climate change. So the systems are in constant change, both not on just the climate, but societies, technologies. They are unexpected events. So you cannot have a fixed policy, a fixed plan. We are in constant change. A third item, and probably there's more than this, but I want to focus on these 3. The third one is complexity. So we know that climate change is complex. It interacts with other areas such as energy, economy, agriculture, health, etc. And we do therefore understand that when we are following fixed long-term policies, they will fail because climate change will require an adaptive, flexible strategies that would respond to uncertainty, to change, and the fact that there are all these interconnected systems. So if we put these three elements together, we have uncertainty, we have change, and we have complexity. And we look at a few examples to illustrate this. So these examples link to these three areas. We have this issue of models, the distribution of hazards, the different exposure patterns, the different levels of vulnerabilities, and the different levels of resilience in communities, in health systems, etc. We have the issue of having or not having adaptive capacity, and we have the issue of attribution, which also has to do with uncertainty and all that, and complexity. So I use this Swiss cheese diagram that you all know from probably from the time of COVID or before. But this one is to illustrate that you have climate change. Climate change produces hazards. Some of these hazards may convert into exposures. Some of these exposures may interact with the community or health system vulnerability, and you will have an impact on health impact or impact on facilities. So underneath there, you have this diagram of what happens when you have one or the other. So the issue is we are very concerned when we have a climate hazard, when we have the exposure, when we have vulnerability, because that will very likely result in impacts. So I wanted to address the importance of thinking in the term of risk as hazards, exposures, and vulnerabilities, whether it's for communities or for health systems, because this model allows us to think this three-dimensionally way that we can act on the hazards, we can act on the vulnerabilities, we can act on the exposures. And we go from a state of high risk to a state of lower risk. Of course, acting on the hazard is a lot more difficult than acting on the exposure. So we can protect people from the hazard, but to get rid of the hazard is something that it needs a little bit of time. That's called mitigation. But anyway, we need these three areas in order to come up with reduced risk to climate change. Another issue that is important in this complexity is attribution. So because climate change will have indirect and complex causal associations, we are facing many assumptions when we do these projections, and we make the quantification difficult. So this diagram is really illustrating this. So it's climate change going through changes in temperature, changes in precipitation patterns, leading to floods or leading to droughts or leading to melting of glaciers or whatever, impacting on people. And there's many, many, many different possible health outcomes, as you can see in that figure. So if you were to look at just one example, we focus on the flood. So it's always this uncertainty, no? Is climate change responsible for the storms? At what fraction of what is happening in the climate we can attribute to climate change or to normal variability? Are the storms responsible for the floods? Are the floods responsible for the water contamination? And all these, are these responsible for infant diarrheal diseases? So you can see the complexity working there, especially when we're trying to think of attributing from climate change to diarrheal diseases in children or any other disease that we care to look at. You have also seen this figure, and it is important because it tries to bring together the issue of risk as a function of vulnerability, hazards, and exposures, and also the issue of health system capacity or community capacity and community or health system resilience. And of course, you have a shock, something that occurs suddenly, like a storm, or you have a stress, which is slow onset, like a sea level rise or drought, and something happens to the performance, whether it's of that community, of that health system, or whatever. And of course, the result could be all the way from collapsing to recovering like before or better than before, or having learned so much about the system that we can completely transform so that the next time this pattern will not occur at all. So We have used this since 2020 in WHO, and because it explains resilience very well. And you can think of COVID. You remember in COVID, there were several diagrams that were similar to this when the performance of health system dropped so much that some of them were actually in some countries close to collapse. So let's move then, after those examples, to monitoring and evaluation. So we understand this monitoring and evaluation as a framework that will help us both not just monitor and evaluate, but also report and learn. So sometimes people call MEL, sometimes they call it MERL, etc. So you're going to find many ways of writing this, but in general, people just talk about M&E, monitoring and evaluation. So having an M&E will ensure that all processes are iterative, flexible. They enable and capture implementation of improvements in adaptation strategies. And there are many examples, but since we worked a lot on vulnerability and adaptation assessments, and they do address the issue of monitoring and evaluation, and specifically in the case of vulnerability and adaptation assessment, that we want to know whether adaptation actions have achieved the desired results to increase resilience. So you monitor, you evaluate, whether resources were used efficiently, whether we are able to change climate-sensitive health outcomes over time. So these are different ways of applying monitoring and evaluation. I think you have also seen this, and because monitoring and evaluation can be included in the whole framework of climate change, leading to health risks, leading to health outcome or health system and facilities impacts. Here are some explanations. I don't want to get into detail, but only to say that I have highlighted health system actions because this is where you would have a plan, an action plan, climate change and health action plan to evaluate the health system actions. And you need that plan to be flexible because if it's not flexible, if it doesn't have adaptive management, you have a very rigid plan that you will not be able to measure or adapt to changes in what is happening when you're doing the implementation of the plan. So overall, what we're trying to say is that when we have climate change and health action plans, we're trying to be flexible in the understanding that what we plan today may not work very well tomorrow because of all the changes inherent in the whole system. There's a lot of frameworks to develop indicators and to measure, in this case, climate resilience of health systems. This is one that we prepare with Peter Berry in the document on vulnerability and adaptation assessments. And it's good because it looks at upstream determinants of exposure and vulnerability, where we use monitoring climate change, hazard exposure pathway, etc. Then the climate resilience of health system functions, where we use the monitoring of health system capacity and adaptation. And then the outcomes of health system resilience, where we're monitoring outcomes measured with different indicators. So the key word here is monitoring. We need to monitor, and eventually we need to do the evaluations. This one no one has seen yet, and it's a very interesting framework. It's coming up in a WHO document in press, and it is interesting, and I put it here because it wasn't developed by a priori, that we develop a framework and we try to fit things in. What we did was do an evaluation of 33 reports. Some of them were health in national adaptation plans, and some of them were vulnerability and adaptation assessments. And we started looking at what indicators for monitoring are these different countries and reports using. And some of them, they were not written as indicators, they were written as statements, or they were converted to indicators, but then we started populating this diagram according to what we were finding. So you would say, oh, but you're missing X. Yes, it's missing because nobody mentioned it. And if someone mentioned it, it is here. So that's the interesting things about this diagram done backwards from having the results to building the framework. Then I wanted to highlight the last part of this. So you see the bottom part, health outcomes, and in the bottom you have monitoring and evaluation. And then I extracted from that report a few examples of what countries consider as enabling factors that focus on monitoring and evaluation. And they say things like, well, we need to regularly analyze risks, vulnerabilities, and emergency preparedness capacity. So these are what the countries are saying in their reports. Or develop and update essential baselines for monitoring climate-sensitive health risks, environmental variables, and health system capacity, etc. So I took a sample of them just to give you an idea of what comes from people that are working in this area and sometimes not even thinking that they are doing monitoring and evaluation. But when you read the report, you find these keywords in there. WHO just released recently the Global Health Strategy, which is called the Global Program of Work number 14, the 14th GPA. And what is interesting is that they mention that the WHO will use the 14th GPW as the basis for the strategic direction of planning, prioritization, monitoring, and evaluation of WHO work. So again, these keywords appears everywhere. And also, and this is very interesting for us because they make link with what we're talking, climate change, to take into consideration the changing state of global health, which includes climate change. So much so that the general program of work has 6 areas, and the first area is climate change and health. So this means the whole organization and member states in the next 4 years are going to have one priority that is called climate change and health, which is very interesting. And then one of there's 2 key areas. The first one is to have more climate resilient health systems that are addressing health risks and impacts. And the indicator there is an index of national climate change and health capacity. And the second one is lower carbon health systems and societies that are contributing to health and well-being. And the indicator there will be the greenhouse gas emissions of the healthcare sector. So just for your information, so how important it is climate change and health at the global level for WHO and countries. You have also seen this diagram, but this is a different point of view because the index that I just mentioned that the WHO will develop or is already developed is built around 10 indicators. And these are the 10 indicators. This document also has not been published. It's in work, but I can show you this. So we have for the operational framework for climate resilient and low carbon health systems. It's got 10 components. And what we did was to find one indicator that could be applicable to every country in the world. So a very basic, simple indicator that countries can measure, but one for each of the 10 components of this operational framework. So 2025 unpublished report again.
Carlos, just to let you know, about 7 or 8 minutes left. Thanks.
Okay, so almost there. So the most important effort on indicators, monitoring, and evaluation is this global goal on adaptation, was established at the Paris Agreement. And recently, about a year ago, an effort was made by enlisting 78 experts globally to work on several themes. One of the themes is health. The health theme is to attain resilience against climate change-related health impacts, promoting climate-resilient health services, and significantly reducing climate-related morbidity and mortality, particularly in the most vulnerable communities. These are the areas. So we started with 10,000, nearly 10,000 indicators, and the challenge was to reduce it to 100, out of which only 10 are for health. And these are going to be used globally by all countries. These are the topics of water, food, ecosystems, infrastructure, poverty eradication, cultural heritage, etc. But importantly, there's also some dimensional targets. One of them is called monitoring, evaluation, and learning. And in this one, these are the 5 indicators that are being revised by the UNFCCC country parties at the moment to see which ones of these they think they can collect and will stay. Just very quickly, just to say that all this links to health. So we always see things from the perspective of climate change and health. So I did this diagram to show that all of these elements that are being considered can have health at the center, whether directly or indirectly or in cross-cutting areas. Finally, I cannot leave this without mentioning about community engagement and a program from Brazil called Vigilância Popular em Saúde. It's like a popular or community surveillance, but it's very different from the community surveillance that we understand, because this is really driven by local communities. They decide what the problems are, they decide what indicators and how are they going to be monitoring. And this is work in progress, because now is in preparation is a guidance on this community surveillance for climate change and health. And with that, I finish right on time.
Wonderful. Thank you so much, Carlos. I thought it was a really excellent overview of adaptive management, but also some of the thinking around climate change and health indicators, and really struck by your comment, that we really, when we're scaling up, we really need flexible and adaptive strategies, and really, not fixed plans or plans that can be changed. And I'm hoping that in our discussions, there might be some this kind of discussion around what does that mean for measuring progress towards climate resiliency in health systems. So next, I'll invite Noemi to share her presentation with us. Noemi?
Yes, thank you. Okay, you can see?
Yes, thank you.
Yeah, okay, thank you. Well, thank you, first of all, to the organizers of this course, to invite me for sharing this case of a study that is called Agile Resilience Mechanism to address the effects of climate change based on the knowledge dialogue of local knowledge in combination with innovative technologies to strengthen food security in community of Nicaya in La Paz, Bolivia. It's a very long title, but yeah, it's because it includes many approaches to about this climate change. Well, this is a model that we described in the previous study, that it's regarding the effect of climate change, of course, where it is evident on agricultural production and generated major problems, especially in the identification of crops and harvest times, which were previously more differentiated, and for seeing frosts and seasonal rains and excessive hail at unexpected times generate major difficulties in agricultural production. That's why we see that we can manage the soil with the plant production, high nutritional values foods in agricultural production using these zeolites and traditional compost. And for the other hand, we have a food and health programs effect of diet on health quality. All, of course, for the people that are living in this community, children, adolescents, and elderly. And the eco-health will living. Of course, the transversal dialogue of knowledge to have the mechanism to address the climate change. So this project responds to the need of investigate the consequences of implementing this that we call ILU resilience mechanism. The ILU is defined as a group of indigenous families that constitute an Aymara or Quechua communities, and it is traditional form of social community organization in the Andean region. So this based on soil management in synergy with dialogue knowledge and the components of production system, education, food, and nutrition, and eco-health. This work was transdisciplinary, so we have researchers from different disciplines, social entities also, the mayor municipality of this community, and organization of associations that are the board of representatives of the schools on the health and so on. So this is the geographical area that we were working. It's in Altiplano, and it's called Micaya in the municipality of Colquencha in La Paz. So the aim was to strengthen the ILU resilience mechanism to address the effects of climate change with the dialogue in the knowledge in combination with the innovative technologies to achieve the security in the food. So the specific objectives were implement the food system to strengthen the food security and health status. The second one, establish the socio-educational and psychological management components for the recovery of ancestral knowledge in dialogue with these people and reevaluating the culture and social identity. And finally, strengthening the resilience and adaptation to climate change of the ILU mechanism in dialogue knowledge with these scientific agricultural technologies. So the methodologies that we applied for the first objective was focus in nutrition and health. In nutrition, we make assessments of nutritional status and also educational strategies encouraging the consumption of food and preparations that they have in this community. Not only the hydrocarbons, but also the other vegetables and fruits. And in health, we perform a health status assessment, evolution of nutritional biomarkers, and of course, we took this genotoxic damage. We noticed that in these communities also they use a lot of pesticides, and there are not well managed, so they have some problems. And we use in dialogue of knowledge with the communities, not only the authorities, but all the participants in this study, improving eating habits, improving nutritional and health status. And in the second one, we work with these professionals that are dedicated to this psychological management, training, intervention with the families and with the ILU, and taking into account the resignification and co-transfer of the knowledge, the original knowledge, the ancestral knowledge, and taking into account, of course, the gender, interculturality, governance. And of course, they were making some workshops with children's agricultural production to know how they perceive the climate change, food and eco-health. And finally, the third one, we practice this improvement of the soil management to have the vegetables and grains production. In this case, we use Swiss chard and lentils to produce in these greenhouses that we were building for them in this community. And of course, taking into account this ancestral knowledge that they have, and of course, the zeolites dosing and other organic fertilizers. And we have some results that we can mention about this the objective that we were trying to reach. And we noticed that a percentage of macronutrients, for example, that we see in the population was not so adequate. We noticed that they have, for example, a deficiency in the calories that they intake with the food and excess of proteins, for example, because they used to have most of the food they have is hydrocarbons, potatoes or something like that, and then of course they used to eat a lot of eggs, for example. And that's why we noticed that in the micronutrient adequacy, a lot, an increase of percentage of iron and deficiencies in zinc, vitamin A, and in calcium. So in this component, nutritional, we perform some workshops with the children in order to know how they perceive the most adequate food they have to take, because sometimes they don't know. So we make some workshops for the children and also for the mothers that in this case the professionals that are in charge in nutrition, they prepare this guide to elaborate this food using the most adequate vegetables and some other food, meat, and so on. They have to recover some traditional food they used to prepare in ancestrally. And of course, they were aware of this component. And in the health, we performed um, some field works to know the health status in this population. We're applying surveys and signature of consents and taking some samples and giving them some results in the field to know if they have anemia, they have urinary infections, or maybe glycemic high or elevated. And of course, all people, original authorities also were participated in this study. We have some results in order to know general characteristics of this population. Most of the participants were women, and the age in these communities are living most people that are elder, not so high. They migrate to another cities. And well, of course, they dedicated to be farmers, and most of the people, and they have, of course, some animals that they grow, and some other aspects of the health. We noticed that there was a high percentage of people, not so high, but that we have to take care is high pressure of these people, and respect to another evaluations that we perform, for example, folic acid and vitamin B12. For example, by gender, we noticed that 32% of the women were deficient in this folic acid, and in contrast, vitamin B12 deficiency showed a significant difference by gender. And in, for example, in this other that by age, most or all the people that were under 40 years have or were deficient in vitamin B12. And about the genotoxic damage, we noticed that we found some significant results of performing with the analysis of comet assay. Now that the differences in women compared to men, men have more damage. In respect to the objective number 2, that was to recover some traditional and originally knowledge related to the climate change, we found that well, the people that were in charge of these issues, they participated in these ceremonies. For example, this Cusillos Festival, that is a part of resilience process, where through drama, children represent food stealing warriors who enter in the houses, and they steal and so on. The community call upon consider the food they should leave behind from them, and yeah, it's a drama. The other one is, for example, the ceremony of Camanas, that they used to fest celebrate when they have these tubers and grains in the agriculture. And this is another kind of tapi they call. It is a ceremony that the people traditionally they used to share the food, and of course knowledge. They share the knowledge. Meanwhile, they are eating, sharing the food. Here are some other draws, for example, for the children's in these workshops that they collects from the psychological and educational part or area were performing, and they draw how they perceive the food, the climate change. For example, story inspired in this climate change, and the other representations of family and how they can avoid these effects of the climate change. And in finally, in the third, we found this. I can show you this growings of in the greenhouses, because in this place they do not have this in the field because of the water, and there is no water, and there is very arid the place. They don't have the as the climate adequate for growing this kind of food. So we found that performing this growing this in these greenhouses with zeolites and fertilizers, they get this big, for example, the Swiss charts and also the lentils. And we analyze in the bromatological analysis of the lentils. For example, they get more protein in this. We notice an increase of the amount of proteins in this growing in these crops. And in the Swiss charts also, we noticed that it was not very high, but yeah, an increase of the calcium and phosphorus in this production. So in the results that we I can make a summary. Promote good eating practices and habits, increasing the quality of agricultural production through the use of zeolites and other inputs in these communal greenhouses, reducing the impact of the climate change, because the zeolites are these rocks that can retain the water, the humidity, and the crops can have this water, and that's why they can help to avoid this climate change, the dry. And compare production with the zeolites and without zeolites, we notice that we have increase in the size of this, for example, the Swiss charts, and promoting the preparation of balanced these dishes based on the nutritional, socio-educational, and psychological management programs. We identify some nutritional practices that the people can adopt or recover to use, and establishing the impact of the intervention, nutritional and eco-health of the population. We determine the nutritional and health status, and we can maybe improve some local policies, improve the nutritional and health of the population. For example, in the breakfast for the children at the school, they can use, they are using now some of this production of that they can have in the greenhouses. And that's for the food security and the resilience of this community. So in conclusions, the findings of the Gaia community reveal multidimensional problems, socioeconomic, nutritional health, and environmental factors, creating vulnerability situation of this community that requires priority attention. But the high prevalence of food insecurity that was found 95% along with the coexistence of malnutrition due to excess. That's why we notice that the overweight and obesity in adults are very common, and deficiency in some other vitamins, for example, in the children's. And this demonstrates a nutritional transition characteristic that is in the rural areas in Latin America, because of the diets that are high in carbohydrates and low in essential micronutrients. So food vulnerability was evident in this population, as most residents are unable to adequate meet or reach their nutritional needs. So this can reflect in the low frequency of consumption of essential foods, such as we have with the nutrient rich, and some other that are protected, as red meat, for example, vegetables and fruits. And respect to the other issues, processes were identified to strengthen community cohesion and allow the preservation of ancestral agroecological practices, as they maintain agroastronomy oriented practices. They recognize the importance of agroecology. In addition, soil, for example, soil rotation for production in the field, are coupled with the rituals that I showed you, the festivities that guide the children toward the preservation of these proba practices, as I showed you, the festival and the kamanas rituals. So there's a need to exchange ancestral knowledge with technical support and cultural reconstruction of this knowledge to bring in the school environment, and maybe differentiated public policies that recognize rural, climatic, cultural, and gender specificity. And according to the phenomenal data of chart plants in this production field, higher zeolite doses showed a slightly plant highly height, no? Demonstrating a positive effect of the development of the plants. The beneficial effects of differentiate slightly in lentil crops were randomness in plants height, but was observed with a correlation between the height and zeolite dosage. So, talking about the bromatological analysis of the lentils show favorable increases in proteins. Total nitrogen was found. This version with higher doses. The minerals, magnesium, calcium, and iron, remain dependent to this dosage of zeolites, except for the phosphorus, whose production was with higher dosage. So I hope I was a little bit fast, but that's why, because we don't have time. Thank you for the attention.
Well, thank you so much, Noemi. That was a really great presentation, and I think really reminds us of some really important requirements for moving forward with health adaptation and scaling them up. The importance of ancestral knowledge with Western knowledge, and sharing that knowledge through dialogue broadly with the community. I thought it was really wonderful presentation. So with that, maybe I'll invite Leila and Jenny. I'm not sure who's going first. Leila, would that be you?
Hey, actually, that will be me. And I'll turn it over to Leila and we'll kind of swap back and forth a little bit.
Oh, great. Thank you.
So, of course, I'm going to share my screen here in just 1 second. Is everybody able to see that and hear us okay?
Yeah, you're all set.
Wonderful. Again, good afternoon, everyone. My name is Jenny McAdams, and I'm here with Leila Abraham. We're here with Franklin County Public Health, located in Columbus, Ohio. A few learning objectives for our session are to describe Franklin County, Ohio, and the climate impacts therein, share ways that local public health in the U.S. can address climate change, describe our air quality monitoring project and the lessons learned, and also determine what data indicators can be used to measure climate and health, especially locally. Just a little bit of level setting. I wanted to share that we are in Columbus, Ohio in the United States, so we're considered the Midwest. Franklin County is the most populous and fastest growing county in Ohio. And we at Franklin County Public Health serve cities, townships, villages within Franklin County, with the exception of 2 of our bigger ones, Columbus and Worthington. I say all of this just to level set a little bit that we serve 41 separate jurisdictions in a relatively small area. 1.2 million people are within Franklin County itself, and the jurisdictions that we serve total about 900,000 people. Our section was created in 2019 in the Environmental Health Division to focus on programs related to sustainability, climate change, lead, and healthy homes and solid waste issues. Just one more background piece that's interesting with where we are and how we're talking about climate and sustainability initiatives is that Ohio is a home rule state. What this means is that our cities and villages have certain powers granted to them in Article 18 of the Ohio Constitution, and that's outside of the authority found in Ohio Revised Code. So local jurisdictions can make separate ordinances and regulations as long as they don't overstep the bounds of the state. This means, succinctly, that we at Franklin County Public Health, with very few exceptions, cannot create any rules, regulations, or ordinances that our jurisdictions have to follow. What we can do is use data to share best practices and create tailored interventions for specific jurisdictions. So it's always best to work with our separate jurisdictions, as everybody has a little bit of different nuances to them and different health outcomes. Having laid that groundwork, I just wanted to share a little bit about the health impacts of climate change in Ohio, and I'm going to turn that over to Leila.
Thank you, Jenny. So our work at Franklin County Public Health is centered on the impacts of climate change here locally in Franklin County. but it's important to acknowledge how climate change is impacting our entire state. In recent years, Ohio has experienced an increase in ticks and mosquitoes, record-breaking heat waves, catastrophic flooding, prolonged droughts, an increase in tornadoes, reduced ice cover on the Great Lakes, and more poor air quality days. And there are many ways that public health can play a role in climate change and adaptation mitigation, such as monitoring air quality, increasing green spaces and tree canopy coverage, providing local food education and access, providing waste reduction education, increasing emergency preparedness education, and vector safety education, just to name a few. And just to put this photo in context here on your screen, this picture is shows one of our tick check stations, and this is a project that's now expanded to almost all of our metro parks in Franklin County. They provide education on how to perform tick checks after visiting the park and a jar to place ticks in if residents find one on themselves or on their animal. In the next few slides, we'll highlight specific projects that we've done here at Franklin County to capture data and to increase climate resiliency in Franklin County.
Thank you. One of the earlier projects we worked on was a heat and resiliency study. Columbus has the fastest growing urban heat island effect in the major United States. So this impacts human health, wildlife, and the economy. Locally and in the United States, the extreme heat kills more Americans than any other weather event, leading to illnesses such as heat stroke and exhaustion. So in 2021, we actually partnered with, in 2022, we partnered with the City of Columbus and to lead a community-led citizen science campaign. And this was really focused on tracking that urban heat island. We used heat sensors mounted on cars and bikes, and citizens went around in one specific time frame, led by the City of Columbus, Franklin County Public Health, Franklin Soil and Water Conservation District, and other partners. And we went through neighborhoods in the morning, afternoon, and evening on August 12th of 2022. What you see here then is the pieces of land and pieces of our area that had extreme heat compared with others. And then in the following slides, I'm going to talk a little bit about tree canopy and how that can impact the urban heat island as well. But I really did want to share and highlight that we have seen an increase in heat temperatures, and they're not going down in the evenings as they used to. So we at Public Health, along with our partners, are really concerned about how to ensure the safety of our residents as well as their quality of life. In 2021, we actually again partnered with the City of Columbus to do a tree canopy mapping assessment. And this represents a quantitative measure of canopy change from 2011 to 2021. Tree canopy is the area of land covered by trees as viewed from above and measures the extent of the region's urban forest. What we created was a way to define urban forests and all the trees within the city across all lands, both public and private, so that we're able to both capture where we can increase tree canopy and where there's a gap in that with some of our jurisdictions. In comparison to 2015, I'm going to slip to the next slide and you'll be able to see a little bit of the differences. But the study calculated and completely reanalyzed data for Columbus and Franklin County. What we did, I do want to just note that this Franklin County was not studied in 2011. So the data from 2021 is Franklin County and Columbus, whereas 2011 is just the City of Columbus. So what were some of the results from that study? We can see here that the relationship between tree canopy and median household income in Franklin County is inverse. So what that means is that those areas with higher tree canopy typically have lower median income. And similarly, we can see that with high daytime temperatures and tree canopy is inverse. And what this really means is that we need to focus on our communities that have more areas of improvement and make sure that we're able to get them the tree canopy they need, or really work together to ensure that there's impactful ways that we can help. What we've seen pretty consistently here locally as well in the United States is that there is that inverse of tree canopy coverage with urban heat islands as well as socioeconomic factors. And so we want to ensure that if there's a way to help everybody have that equilibrium, then we are able to do that. I'm going to turn over to Layla to talk about our neighborhood level air quality monitoring network.
Great, thank you. So over the next few slides, I'm going to talk briefly about our air quality data collection efforts here in Franklin County. So this all began in 2021. Franklin County Public Health partnered with our Regional Planning Commission, and we call them MORPC. And we received funding to create a pilot project to establish the very first of its kind low-cost air quality monitoring network here in Franklin County. And the motivation for this project was to fill in gaps where there were no regulatory air quality monitors and to understand if some neighborhoods were experiencing more air pollution exposure than others. We wanted to start with monitoring PM 2.5 because it's proven negative impacts on public health. And in our network, we used Purple Air sensors for their cost effectiveness, their user-friendly setup, the broad use across the country for citizen science projects, and their ability to transmit the PM 2.5 data in real time to an interactive map. We sited our sensors at libraries, community centers, government buildings, and at the homes of residents and collected data for 1 year. After the analysis of our data, it became evident that we needed a denser network of Purple Air sensors to get a more comprehensive picture of the PM 2.5 levels at the neighborhood level in Franklin County. And this is just a quick note. So to help inform the placement of our sensors for our very first pilot project and moving forward, we generated a vulnerability metric, and that used socioeconomic and health data at the zip code level. And the map on the slide here shows the results of that analysis, where less vulnerable zip codes are in green and more vulnerable zip codes are shown in orange and red. And we vetted this project with an advisory committee of residents, which also provided us further input on where to site our sensors throughout the county. And using this process, we aimed to place sensors in zip codes that could cover the full range of this vulnerability scale, but with additional focus on high vulnerability communities. And this data-driven approach allows us to create an unbiased approach that can be justified with initial residential input. So after the very positive community response we received to our pilot project and realizing that we needed more sensor coverage throughout the county, our team started looking for funding to expand our network, and we thankfully received federal funding in 2023. With this funding, we were able to expand our network by an additional 40 sensors, and you can see a snapshot on the slide here. This is a lot of our sensors. There are also sensors that are owned by other hosts, but these are many of the sensors that are in our network. And we created a project advisory committee for this project made up of community members. And their role is to guide our sensor placement, community engagement activities, and to address any community concerns along the way. And we're collecting data for 18 months with this project, and we'll conclude next June with a report of our findings. And with this funding, we're also able to hire a consultant to create a model using data from our sensor network and other local sources of data to help us better understand the air pollution patterns and sources of pollution in Franklin County. And as I mentioned, what I really love about Purple Air is that this is global. So if you want to take a look in your country, your city, your village, your township, go to map.purpleair.com, zoom in, and you can see across the world the Purple Air sensors that are near you. And so because of the community engagement and work that our project team did, the value of low-cost air quality monitoring began to generate a lot of interest here in Franklin County from local universities, local government officials, and even some national organizations. So just a few notes. We had a local university that donated some of their unused library of Purple Air sensors that we could use as a backup if any of our sensors in our network went down, which was a huge help and very kind of them to do. And we were also approached by a city council member at the city of Columbus who's interested in helping us expand some sensors in their jurisdiction as well. And so we were fortunate to have funding provided to us to purchase more sensors. And we're also currently in the process of receiving additional funding to support our project to purchase more equipment and community engagement efforts from the National Resources Defense Council and from the Sustainable Cities Fund. And I share all of this to say that when our pilot project first started in 2021, our team wasn't really sure where we'd go, how far it would go, and how our network would evolve. And so it's really important to note that our partnership with the community through the initial pilot all the way through to the expansion of our network and beyond is the reason why this project has been so successful and been able to scale up. And because of their support, we've been able to create meaningful partnerships and secure this additional support from very important partners. And last, as we continue to expand our network, we hope to host learning and engagement sessions throughout the county, encouraging residents to get involved with our project and have a public-facing dashboard created where community members can find more information on air pollution in the region and how to protect themselves. Additionally, we're going to continue to work with our consultant to utilize modeling to help us understand the air pollution patterns in Franklin County and sources of pollution here. And our overall hope is that this knowledge and data will be able to be used to empower residents to take health protective actions, to advocate for solutions to improve air quality locally, and to eventually move just from data collection into action.
One last component I did want to, highlight is our project with the Climate Data Dashboard. The Climate and Health webpage launched in early 2024 with assistance from a grant from the National Association from City and County Health Officials. And it was also with the partner organizations such as the State Climate Offices of Ohio, as well as the Bird Polar and Climate Research Center at The Ohio State University. And what we did was, because climate change and its impacts are inherently local, data becomes critical in helping us to understand the state of our communities, as we've shown throughout this presentation. The more data we have, the better we can work with our communities and address most pressing needs. And public health surveillance is fundamental to creative public health practice, and it's been widely implemented from topics. So we did this project, and we worked with, again, the Bird Polar and Climate Research Center and the Ohio State University to help identify indicators that made sense for our region. These may not make sense for every region. These are just specific components that really spoke to us and that we could track and cover and see differences from year to year, month to month, and sometimes day to day that impacted the health of our local citizens. I'm not going to read them all, but I do want to highlight the heat-related injuries, mosquito-borne diseases, and tick-borne diseases, as well as unhealthy air quality days. So with our collaboration, we've been able to launch a climate and health data dashboard that we can use when we're completing or creating best practices or innovations, or anybody in our community can use as well to start to really look at local ways to impact climate change. And with that, I will rest there. Thank you so much for your time and happy to answer any questions.
Great. Well, thanks so much, Jenny and Leila, for that great presentation, really emphasizing just how important data is in terms of helping to inform that health adaptation that we need to scale up. And I noticed actually a common theme among all the presentations, the importance of community engagement and being able to reach out to the community and have input and also share results. So that was really, really great. So I'm going to go to the questions now. We've got about 20 minutes for questions, and we have a lot of questions, which is really great. So I will go first to Carlos with a couple of questions, if I could. So Carlos, we have a question. I'm curious about the thematic targets. Culture is at the bottom of the list. Where we try to decolonize our processes, culture preservation needs to be considered first, and that would influence the rest. So, for example, consumer culture influencing water, food, and ecosystems. Can you, sort of reflect on that in terms of your work on indicators and where culture has come into that?
Yeah, sure, Peter. First of all, just let me make a very quick comment about the presentations, which were all very interesting and relevant. And I think that Naomi really touched upon adaptive management, so getting the communities to actually manage their concerns. So that was very good. And then the other one, Leila and Jenny, you were more into the issue of monitoring, which leads to evaluation, which importantly, and you mentioned it leads to action. So that's what we want, is action. So I think that was very, very interesting because it's complementary. And I think, Peter, you made a very important, interesting point about involving communities. So 10 years ago, people were doing this research completely isolated from the communities that should be involved. And I think that all of this effort that we're talking about, and the last slide that I presented from this community surveillance in Brazil, everything that you spoke of, and working with communities, some more than others, some are more into getting the communities to decide by themselves what they need to, or they should be investigating, monitoring, and acting on. Regarding your question, Peter, personally, I think that there is no order. It's a pity that culture appear at the end, but I think that it's in fact really important that now we're thinking differently. So we're putting something called culture in indicators, which is perhaps 10 years ago, we would have been more sort of like a scientific mind that we need to measure very carefully. What can we measure? Things like poverty or culture are extremely difficult to measure, and to measure have indicators that have an impact on the adaptation to climate change, especially when you are only allowed to have 10 indicators for each. I mean, we spoke now a lot about culture, a lot about, I mean, how many indicators could we just dream from this session alone? I think we'll get easily 50 indicators that linked to the work that we're discussing. So in summary, I would say that it's just a pity that appears at the end, but it's great that it is there. It's important that it is there. And all this indicator effort has not been easy. It's been extremely difficult to come up with agreement among the team of experts, and more difficult it's going to be to come up with agreements now that these indicators are being discussed with countries. When you speak of culture, you're speaking of something that is not as objective as measuring temperature. We're looking at different countries, different communities, different populations with different interests. So culture becomes a very difficult and extremely important topic to get it right.
Thanks, Carlos. Maybe one more question, which I think is a very interesting one as well, and quite timely. Can you provide specific examples of how adaptive management has successfully worked in practice? Do you know of any countries that are actually adjusting some of their activities based on monitoring data? Perhaps using the framework that you had developed in terms of climate resilient health systems. That's a very interesting one.
Okay, so it's interesting, Peter, because when I saw the learning objectives and I saw the keyword adaptive management, and then I realized it's not something that we use a lot. I went through WHO documents and I found the words adaptive management together in very few documents, and sometimes in different contexts. With adaptive management, because funding is very restricted globally and we have to think differently. So the way that we are approaching it here, it's very, very different. I think that perhaps when we have done the vulnerability and adaptation assessments, which lead to health action plans, national action plans, without speaking of adaptive management, this is actually implicit in the work. No plan addressing climate change, addressing the future that we're facing, could be rigid. Every plan would have to have some flexibility, some adaptive management built into. Otherwise,
thanks, Carlos. I have a question for Noemi now, if I may. How do you, or can you, ensure the sustainability of some of the proposals and projects like the ones that you presented? And what and how do you involve, I guess, local governments to promote these projects?
Well, of course, the sustainability is not assured. we have to be pushing well, for example, we have work in this community. This is a small community in the Altiplano. So first of all, we have to make they aware about the problem they have about related to the climate change. Of course, in the nutritional and health effects that it's um, that they can maybe not perceive as well because we were working with them in workshops and some other information to make them to aware about this problem and related to the authorities that they were participating. The mayor of this community was very open to and get interest for this problem, and they of course want they need that the people that are living there don't go to migrate to another communities or to another cities because they need to grow the community by themselves. It's a little bit difficult to assure that they will be um, maintaining this growing this crops in the greenhouses, for example. But I think that the originary authorities also they aware about this problem and they say, well, we're going to invest in these seeds, for example, to have in the greenhouses. And yeah, that's difficult, but we are trying to make the people aware about this problem.
And one
Yeah.
more question. Was it possible to recruit healthcare volunteers? Like, did you have any challenges with engaging with partners to participate in the project? I know in Canada sometimes that's been an issue in terms of some projects. Was that a challenge at all?
I don't know if you mean related to some support, only not only financial support, but kind of support.
I think
Or,
just maybe participating in the project, either through providing
okay.
information and data, or doing some of the analysis, or helping organize workshops, these kinds of things.
Okay. Yeah, no. We only have these two supports in this case in the IAI, that it's of course financial support, but also the people that are working in this consortium, they can help us in terms of advising something. And in another was the Swiss cooperation that we had previously. But yeah, I think it's important to take into account this in order to show, of course, to share the information and to maybe they can help us to make some other assessments. Yeah, I think it would be interesting to continue in this, to have some other spots.
Great, thank you. So for Jenny and Leila, interesting question. How do tools and indicators relate to decision-making processes by political authorities? What do decision makers need to know about your data, and how do you communicate it to them?
It is a very great question, and we've been working on that for quite a while. One of the biggest lessons I would impart that we've learned a lot from is ensuring that the data has been studied for a certain amount of time, for an applicable amount of time. So if we're using, let's say, our air quality, it's a point in time. So what we wanted to do was make sure that we have that 18 months of study so that we can share a very thought out and level approach. So we typically do try to collect quite a lot of data, at least a year's worth, just to make sure that there's no anything going awry or any issues with like perhaps a measurement material or something that kind of crops out of nowhere. And we use that to really show our jurisdictions and our political authorities that this is the trends in the data and we can impact it by X, Y, and Z. Because we want to ensure that as we have those interventions and mitigation activities that we're not constantly changing those, that what we're impacting is something that we know is going to continue on for a while. And now, Layla, I don't know if.
Well said.
But it is tailored specifically for every jurisdiction, and we try to get as granular data as we can, although it's obviously not always possible. But in Ohio, especially in Franklin County, we have very vastly differing life expectancies, even by zip code, which can be a mile or two apart.
Great, thanks. And maybe to follow up on that one, a question about how did you measure greenness? Did you classify the vegetation or with satellite images? What sensors were used for vegetation tree canopy analysis?
Thank you. We actually used LiDAR, which is light detection and ranging and aerial imagery for that. So that our consultants did that study. And if you look further into it, and I'll put the link in the chat, we have quite a lot of satellite imagery from that. We were not able to differentiate in types of vegetation, but we could tell the differences in height. So based on that, we made some references or some inferences that this may be a bush, this is a 10-year to 20-year-old tree. So we were able to do that and then look at some areas where possible increases in vegetation were possible.
Great. Thanks for that. Maybe I'll go to Carlos. Interesting question about local health indicators and how can local health indicators in each country have a positive impact in the face of potential climate change events? And really, are there transdisciplinary participatory agendas or I guess mechanisms to use these health indicators through that so they can be actioned and affect the community? So perhaps reaching out beyond the health community to other partners.
Yeah, Peter, thanks. So yeah, there was another question that I did answer, which perhaps was the opposite, is whether these indicators that we were talking about, whether it's WHO indicators or the UNFCCC indicators from the Global Goal Adaptation, at what level are they? Are they global, international indicators? Well, they are national indicators because they are or they will be collected by countries in order to build a global picture. But your question goes the other way around. So when we have local indicators, what is the relevance to national indicators? I think that's what you're asking me. My take is that there will be some local indicators that are very local because other communities, other parts of the country may not have that problem, and therefore they need to monitor and evaluate their actions in front of a very specific hazard that a community or area may have. For example, not even in large countries. I was in a conference recently in Singapore and hearing colleagues from Fiji saying that in part of the country they have drought and in other parts they have flood. And you think of Fiji being a small island, how could this happen? Well, it could happen not necessarily simultaneously, but it could happen according to seasons. But different communities are impacted by these hazards, not the same community. So not everybody suffers from drought, as not everybody suffers from floods. So I suppose that there would be some local lessons that you can extrapolate to the whole country, but perhaps the actions that you take for specific hazards, protecting facilities, etc., will be very, very localized. Just one example. Another example is sea level rise and how a small country like Kiribati had to relocate their hospital, which was 5 meters from the sea, to the furthest point from the sea, which was 500 meters from the sea, which is really for us, it's like very, very close. But this is one part that has a problem, whereas another part of the country or another island may have a different problem. I hope that answers.
Yeah, thanks very much, Carlos. I think I've got a question for Noemi. What socioeconomic and environmental factors, and I think you may have touched on a few of these, act as critical facilitators or barriers in this transition in terms of food systems that you mentioned, the needed transition?
Mm, well, sorry, I missed the first part of of the question. Could you please?
Oh, sure. Which factors, like socioeconomic factors, in terms of some of the vulnerabilities that I think you may have mentioned in your presentation, or some of the environmental factors, are really critical as perhaps barriers to the food system transition that was a focus in your presentation?
Okay. Well, of course, the social and economical situation is, of course, is a problem. But yeah, it's because of there are not many support for the agricultural production, for example, and of course in this maybe it refers that I mentioned that before we have some other knowledge about this production that now is not taken into account because of the this changing, because all of this knowledge maybe is not now um, going to through the new generations of the people. I don't know if maybe it's that that mean that question, but also now that's why we want to recover this ancestral knowledge for the people in order to recover, for example, the traditional medicine or the food for the nutritional uh, um, nutritional products, because now we have some other influence of these products that are getting the people, of course, not in these communities, but maybe in the cities that are not very quality for the nutrition purpose, for example, as they have this also this modified uh, genetically modified food, for example, and it's not a very nutrition support or support for the people, for the health, and also, of course, the is changing because of this influence, and of course, in these communities that we were studying, the people is poor people, not they don't have economical situation, a good economical situation, of course, and they can improve this with this support, combining the traditional knowledge or they have the ancestral knowledge to produce, and these other ones that are occidentally knowledge about this cell light or some other, but not using more chemicals, but some other strategies to produce the food. They have they could have this more valuable food with the characteristics to have a more nutritional and well health.
Great, thank you very much. Well, I think we've reached the end of the webinar for today. So I just want to take the opportunity to thank our presenters very much for your excellent presentations. and to thank all of our participants for attending today. Don't forget to come to the next session, which is in a few days. It's going to be a really interesting session based on a sort of an interactive approach to the course. There'll be discussion around some of the results from the survey that people have filled in. So I think that's going to be a really interesting discussion around scaling up health adaptation, and that's in just a few days. So thank you again for attending. I hope you have a great rest of the day, and I look forward to the next session with everyone. Thank you so much.
Thank you. Bye-bye.
Thank you. See you later.